Hello, my name is Katsuya Maeshima. I'm emergency physician at Keio University School of Medicine. I appreciate you taking time to watch this presentation, which is titled Novel Scoring System to Predict the Requirement for Angioembolization in Patients with Brain Trauma. We do not have anything to disclose of interest in this presentation. Although angioembolization (AE) has been increasingly used to manage solid organ injuries and hemorrhagic pelvic injuries, particularly retrospective analysis of pelvic fractures suggested that early angiography and embolization was associated with lower mortality. So AE should be performed as early as possible. There are a considerable number of facilities which lack radiology specialists round the clock, and early prediction for implementation of AE is important. We conducted this study to develop and validate a novel scoring scale angioembolization in patients with brain trauma (AEB) score that predicts the need for emergency angioembolization. In this retrospective cohort study with Japan Trauma Data Bank 2004 to 2019, adult patients with brain trauma who presented with palpable pulse were identified. Based on the date of injury, patients were allocated to development 2004 to 2013 or validation 2014 to 2019 cohorts. Data collected included age, sex, mechanism of injury, injury severity score (ISS), vital signs upon arrival, transfusion within 24 hours after arrival, emergency angiography, emergency angioembolization. Emergency angiography was defined as angiography performed within 24 hours after arrival. Emergency angioembolization was defined as same. There was no apparent difference in all items between two groups, including age, sex, vital signs, ISS. Predictors of the need for emergency angioembolization were identified with multivariate logistic regression. Pedestrian auto-collision respiratory rate is greater than or equal to 22 per minute. Heart rate is greater than or equal to 100 per minute. Systolic blood pressure is less than 100 millimeters of mercury were identified as independent predictors. In this analysis, although motorcycle collision, bicycle collision did not significantly increase the risk of performing emergency angioembolization, increasing the number of patients might make significant differences. Generally, older age is risk of bleeding. So, age, motorcycle collision, bicycle collision were also included in predictors. Scores were assigned to selected predictors using odds ratio, and the AEB score was developed as 0 to 12 scales. The score had a good discriminatory power. Area under the curve was 0.75. 95% confidential interval was 0.74 to 0.76. Estimated and observed rates of emergency angioembolization increased stepwise from 1% at a score less than or equal to 3 to almost 20% at a score greater than or equal to 10 with linear calibration plots. AEB score was developed and validated as a scoring system for predicting the requirement for emergency angioembolization.